¿Cómo se oye esto? Ahora. Well, good morning to everyone. We are going to start this session that is sponsored by the Spanish Society of Hospital Pharmacy, in which we will discuss the training in Spain of the hospital pharmacy specialist. Before speaking, I would like to thank the attendees for their presence at this session, and of course the speakers that are being here at the Faculty of Pharmacy of Salamanca for informing us about this key issue for the future of our profession. Let me mention, to introduce this session, that the Spanish Society of Hospital Pharmacy has always believed that the future of the specialty of hospital pharmacy depends on the training that their professionals receive. For this reason, as the title of this session points out, our society has always worked towards and is committed to the training and professionalization of its members, with the fair intent of promoting the development and progress of the hospital pharmacy in Spain. On the one hand, our society has worked to guarantee the training of the new specialists who are going to carry out their activities at the hospital. And therefore, in our country, since 1984, the studies to obtain the title of specialist in hospital pharmacy have been regulated through the author residency program in hospital pharmacy that nowadays takes 4 years to complete. In addition, the Spanish Society of Hospital Pharmacy is well aware that due to the important advances and changes in the field of pharmacy, the practice of hospital pharmacy requires continuous training to improve the skill and performance of the professionals, and also to develop creative pharmacists who are able to innovate and advance in our profession. In fact, I would like to highlight that the strategic plan 2015-2019 of our society has among its objectives to train hospital pharmacists to face these new challenges. This plan includes the knowledge management as one of its 5 strategic goals in order to promote the continuous training of its members. Well, in this session, we will have the opportunity to learn about the initiative addressed by the Spanish Society of Hospital Pharmacy and its results in training. At the first conference, Dr. Ana Lozano will present to us the Spanish model of specialization in hospital pharmacy, the training program, and the competence evaluation system. She will present the results of this Spanish model, which may serve as a guide to apply in other countries. Dr. Ana Lozano studied pharmacy in this faculty. Welcome again to Salamanca, Ana. And afterwards, she made her residency in hospital pharmacy in the Hospital of Cabueñes in Gijón, and her doctorate in the University of Granada. She currently works as the Chief of Pharmacy of the University Hospital Central de Asturias in Oviedo. She is participating in this session because she is the Vice President of the Spanish Society of Hospital Pharmacy, a member of the National Commission of the Specialty of Hospital Pharmacy, and a member of the Tutor Working Group of the Spanish Society of Hospital Pharmacy. Thank you, Ana. The second speaker, Dr. Ana María Cordero, will speak about the continuous professional development program developed by the Spanish Society of Hospital Pharmacy, an innovative program to improve the education and professional skills of the staff pharmacy and technician. Dr. María Cordero is a specialist in hospital pharmacy, but currently works as a professor of pharmaceutical care and pharmacology at the Francisco de Vitoria University of Madrid. She has published several articles of clinical pharmaceutical interest and has participated in several national and international meetings. She is participating in this session specifically because she is the Deputy Director of Training of the Spanish Society of Hospital Pharmacy. Thank you, Ana. And finally, Dr. Manuel Murillo is a resident in hospital pharmacy that will read us his point of view as a resident, not only about training activities, but also with respect to other initiatives addressed by our society, such as grant, research projects, and the International Program of Center of Excellence in Hospital Pharmacy. Manuel Murillo is in his 4th year of residency at the University Hospital Virgen Macarena of Sevilla. He is a very active resident, and for this reason, he is the representative of the resident at the Spanish Society of Hospital Pharmacy. Manuel is here because our society, the Spanish Society of Hospital Pharmacy, think it would be very interesting to know the opinion of the residents about their training and how I could be improve this training. Well, thank you so much to all the speakers. Now we prefer to be sit down, and Ana Lozano is going to start the first conference. Thank you.
Well, thank you very much, María José. Good morning to everybody. First of all, I would like, in the name of the Spanish Society of Hospital Pharmacy, to give thanks to the Scientific Committee and the Faculty of Pharmacy of Salamanca for invite our society to be here with us. For me, it's a special moment to come back to the faculty where I studied to become a pharmacist. So I will try to explain how a pharmacist become a specialist in hospital pharmacist. And for that, I think we have to remember where we do come from and where we have arrived now. Although hospital pharmacists are working in hospital for many years, it was in 1977 when there was a legislation, an orden ministerial, who regulate the hospital pharmacy departments. And this legislation establishes the roles of hospital pharmacists and the responsibilities. The main law for pharmacies, which probably you may know, the law of medicines from 1990, in the Article 92 says that hospital with 100 beds or more will have a pharmacy department under the responsibility of a pharmacist specialist in hospital pharmacy. And this is very important because if you look at the map of Europe, you can see in blue the countries where the specialization is mandatory for work in a hospital as a hospital pharmacy in a pharmacy department. As you can see, there are few countries. One of the countries is Spain. So how we become to pharmacists? Well, we use the FEAR model, the pharmacy residence. That is the same model as it is used by doctors, by nurses, by psychologists, all the healthcare professionals. And it is a model that was born in the 60s for doctors. It is called MIR, and you probably know this model. It has one annual and national exam to access to be a resident. It is based on learning on the job, and it is regulated by a law in 1984. And this model, it consists of learning through the program supervised professional exercise in such a way that the training specialist acquires gradually the professional knowledge, skills, and attitudes that allow the autonomous practice of the profession. The characteristics of the models are the accreditation of healthcare centers and teaching units, the quality training monitored with audits, universal entrance exam, and the definition and classification of specialties and associated training programs. In 1977, it was the first call to do the exam for pharmacy residents, and this time it was only for hospital pharmacy. It was the first specialty with the model. After that, there has been more specialization, and you can see here all the specializations we have now. In this picture, you can see all the specialization, for example, in this year, and you can see that the total number of vacancies was 226, and for hospital pharmacy, they were 129, almost the half, or more 60% or so. And as you can see, each autonomous region has a number of specialties depending on the hospitals and pharmacy departments that are accredited. Here you can see in blue the applicants each year for the exam to do the residency, and in red the vacancies there are each year. This is for all specialties, not only for hospital pharmacy. So you can see that there is more or less one vacancy for 5 applicants. And in this graph, there is the number of hospital pharmacy between the years, and you can see the growth of the vacancies. In the last years, there was a decrease. It was because of the crisis we have, but now they are increasing again. Inside this model, there is a part that is very, very important, that is the National Specialty Commission. This commission develops the training program, establishes the evaluation criteria for training specialists, establish evaluation criteria for teaching units, and propose the accreditation of specific training areas. This is the 8 commissions we had. The first commission that was formed in 1989 did the first training program in 1991. It was a 3-year program. And then the 5th commission elaborated the second training program in 1999. That is the program that we are working now. It is a program for 4 years. Then in 2008, the Commission elaborated another program, but this program was never approved. In 2014, there was a change in our specialization because the Ministry of Health considering the changes that they were in the healthcare and in the patient, that sometimes is in the hospital and sometimes is in primary care or nursery homes. They consider that we should have a specialization for all that, and they changed our specialization from hospital pharmacy to hospital pharmacy and primary care pharmacy. So they changed the National Commission with a commission with that name and with members from hospital and members from primary care. And this commission did another program in 2016. Well, in this year, the decree that regulated this program was annulled by the Supreme Court. So we have come back to the previous specialization, hospital pharmacy, and now we have a National Commission of Hospital Pharmacy. This commission, I belong to this commission, as Maria José said. We have done another program that is based on the previous program from 2016, but we are waiting to be approved. Well, you can see here the development of hospital pharmacy in Spain. The beginning of the hospital pharmacy was working with procurement, compounding, and distribution of medicines in stock. But then in the 70s, you can see we changed to selection and drug information, to do a distribution individualized, to create a centralized unit for IV mixtures and artificial nutrition. In the 80s, we began with clinical pharmacokinetics, with pharmacovigilance, with clinical trials. At the beginning of this century, with quality management, with individualization of therapy, pharmaceutical care, and now we are working with pharmacogenetics, with applied investigation, and in the coordination between levels of care. Well, this development of our work, it has to do with the number of hospital pharmacies that we have now. You can see that at the beginning we were 100 pharmacies, and now we are more or less 3,500 hospital pharmacies specialists. Well, this is the first program. It was a 3-year program with, at the beginning, with 6 months of basic training, and then 30 months with specialized training in these all areas. The second training program, it was a program with another year, 4-year program. It has the same basic, sorry, it's in Spanish, a basic training of 6 months, and on 30 months with specialized training and with more areas added from the previous program. And then another year, 12 months, with a practice pharmacy with pharmaceutical care in the wards of hospitals. So what do we have now? Well, now we have a society who is changing. We have patients that are more involved in their illness, in their treatments. We have a lot of technology in our hospitals. We have more outpatients than inpatients, and we have working teams with all the healthcare professionals. And we have this was the pharmacy departments that used to be in the basement of the hospitals, but now we have all the pharmacies working all over the hospital in wards, and we all with the rest of the professional teams. And as Paul Abramovich, CEO of American Society of Health System Pharmacy, says in this paper, there has been an evolution and metamorphosis of pharmacy practice model for hospital pharmacy, from hospital pharmacy to clinical pharmacy to a specialized clinical pharmacy, and finally, where we are now, to ambulatory care pharmacy. Now we have a healthcare system who is centered in the patient. It is not centered in the illness. It is not centered in the treatment. It's the patient, the center of all of our work. So we have to think if all that things we used to do are enough for that. Because we need professionals with ethics and values, we need professionals with clinical skills, scientific knowledge, information management, rational use of health resources, communications skills, critical approach, and investigation. With all that things, we can define to understand that professionalism as skills, attitudes, and behaviors which we have come to expect from individuals during the practice of their profession, and includes maintenance of competence, ethical behavior, integrity, honesty, altruism, service to others, adherence to professional codes, justice, respect for others, self-regulation. And we can define two competence as behavior resulting from a set of attitudes, skills, abilities, knowledge, and values that people use to deal with specific situations related to their life and profession. So with that, we have the components of the competencies, and the components are attitudes and values, skills, and knowledge. And as you can see, we have here in the center a mixture of all that in each competency. And if we look at pyramid of Miller's for assessing clinical competence, you can see how you acquire the competencies with the first step with the knowledge, then how do you apply this knowledge, how you do demonstrate the learning, the knowledge, and at the end, at the top of the pyramid, how do you work, how do you perform this knowledge. So, with all that, we need a new program, and we think we need a new program because the continuous growth of pharmacy departments accredited, the growth of activities of pharmacy departments, because there are more pharmacists and more specialization, because we have new and different ways of working, because there are new labs for competency training and assessment. So with all that, we did this last program in 2017. This program updates the contents of previous program. And it was with hospital, primary care, nursing homes, and it's a competency-based model, as we explained before. It has 12 general domains and 55 general competencies that we share with the rest of the professionals that that train with this model. We share these domains and competencies with doctors, with nurses, with psychologists. And then we have 17 specific domains and 73 specific competencies. We have 5 assessment tools, and we share these tools with the rest of professionals. These tools are exam, direct observation, audit, portfolio, and 360 degrees evaluation. And we have 229 evaluations in this program. So with all that in our society, in SEFH, we did a white book to see the situation of hospital pharmacy departments in Spain. And regarding teaching accreditation, we have found that on average, pharmacy departments that have a teaching accreditation train up to 5.7 pharmacy residents, and more than 6 pharmacy residents in hospital with more than 500 beds. 37% of the pharmacy departments have teaching accreditation for training pharmacy residents, but almost half of hospitals between 250 and 500 beds do not have teaching accreditation. This is because the SEFH is committed to residents and to training residents. Each year we have a one-day session for the residents of the first year, residents who begin their specialization. And we have a working group of tutors that we try to help tutors and the rest of the pharmacists to train and assess the residents. We have produced some books. This is a book for competency-based assessment. And we have another book for tools for hospital pharmacy residents assessment. So, to finish, I would like to say, and I think that the future is created by what you do today. So, we are working today for the future of our specialists. Thank you very much. It's not my presentation, please. Yes? Okay. So, good morning. First of all, thanks for organization to invite me to, excuse, wait a minute. Now, yes. Okay. So, thank you, the organization, for inviting me to give me an opportunity to talk about training area of Spanish Society of Hospital Pharmacy.
I would like to start with this picture because sometimes the world of medicines is like a forest, a huge forest, where we can feel a bit lost. So, for example, a bit often frequency question in our hospital could be, what medication choose? How can I do this? And so on. Training area of SEFH will try to help hospital pharmacists to choose the best option. So we offer e-learning websites, seminar, webinar, and symposiums, and our pharmacy hospital journal. So on, our national conference, SEFH, this year in Palma de Mallorca in November, and our e-learning websites have different groups. First of all, it's pharmacy intern resident. We have different courses for the residents, for 4 courses, and the hospital pharmacist specialists. More than 2,400 students enroll our courses. It's an important number, and expert hospital pharmacists for pharmacists with a more specialization in this area. Besides, pharmacy technician is an important group for us because there are a lot of people, more 4,200 students enrolled last year. For this reason, from ADA training, our society, we try to base our courses in different competences. Generic competence, like the clinical communication, team working, investigation research, or specific competence, como evaluation, selection of medication, pharmacokinetics, and so on. We have a training plan and schedule in different years, like you can see this, but it's sometimes constant challenges, and the growth of our profession is necessary to improve and to do innovation process. So, different is not only a innovation project, attractive, dynamic, but also we have to offer a different option to train. For example, our innovation in continuous training now, we are developing a new training management platform based on process management system, digital tool for personalized training, and a clinical assessment tool. On the other hand, we are developing personal portfolio management based on certification model, personal training registration, accounting of training credits. But a picture is worth 1,000 words. I would like to show you this video. Wait a second. Now. Please. 1 second, please. Wait a minute. Well, so to continue, please. But let's not forget our goal is the patient. So, like a health professional, should be the patient care in order to get the best health results. So, thank you, and thank you for all.
Pasando aquí, ¿esto sirve para el puntero? Y para pasar. Okay. Good morning. My name is Manuel Murillo. I'm a hospital pharmacy resident from Virgen Macarena Hospital in Seville, this beautiful city you can see here. I'm also the representative of the hospital pharmacy resident since the last Congress, which was celebrated in October of the last year. I would like to express my gratitude to the IPAP Congress because I feel like a small drop of water in this big sea of scientists. It's for me also an honor being here with you sharing all this information. And that's the index of my presentation. I'm going to talk first about the FEAR exam. Again, what do we do for training? The second question is, what does the SEFH do to improve training of resident pharmacists? For example, courses, research and innovation, tools for residents assessment and grants. And I will end with current projects and my personal conclusions. So I will start with FEAR exam. What do we have to do be in a hospital pharmacy resident? As you know, at first we must study a pharmacy degree which consists of 5 years. Then we have to pass a national exam called FEAR. It's a hard period of time where you have to study hard because it isn't enough just to pass in the exam. You have to get the highest marks in order to be as a resident in a hospital pharmacy. And the resident consists in a period of 4 years, 1 to 4. And is it easy, the exam? Well, it depends. If we compare with doctors, we are in a more competitive situation because our ratio is 1 position for 5 students. But in medicine is 1-2, but psychologists it's 1-33. So we are in a better situation compared with psychologists. And how many are we? Our society has 3,700 members, and residents, we are 582. So we are at 60% of our society. And what do we do for training? The first point is easy. Learning from the more experienced pharmacists. You know that copy is one of the best ways of learning. We also start a master or a new degree. For example, I've done a master in clinical trials. Then we also go to hospital clinical sessions. We study guidelines about a specific pathology and its treatment. We must be the experts of drugs. And then we use SEFH resource. And what does the SEFH do to improve training of resident pharmacists? At first, we have different courses, a wide range of courses. For example, general courses about pharmacology, but we also have specific courses in such areas like clinical nutrition, mental disorders. Why? We want to have pharmacists, specialists in these areas. R1, the youngest resident of our society, we are worried about them, and we have designed a specific plan for this type of resident. For example, we have prepared a course about scientific writing, search skills or bibliographic databases like PubMed or Scopus, and statistics, which is one of the most important things of our training. we are also changing the way of learning. Personally, I believe that we must be more practical. Just using a PowerPoint with a lot of sentences and then doing an exam about concepts, I don't believe in this way of learning. I think it's better a PDF with basic concepts than with the help of explainer videos about, for example, a clinical case, a specific patient, and then we should do exam about clinical cases where we could evaluate the global situation of the patient. Courses about digital skills. What do we know about digital skills? Do you think that we have enough? Well, we are wrong. Look, there is a document and a project discovered from the European Union which says that 44% of the European population aged between 16 and 74 years has insufficient digital skills. And Spain ranks 14th position of 22 countries. And that's the index which evaluates our digital skill. So there is a need to do a lot of courses, not just only in pharmacology and in treatments, but also tools to improve digital competencies for our residents. Research and innovation. We believe that resident is an excellent period of time for starting a PhD. In the past, we identified that there was a problem when a resident wanted to start a PhD. They were also wondering, what could I do? So that's we decided to create a platform which is so easy. You just have to fill a document with your name, surname, hospital, PhD research topic, and then they put you in touch with a tutor. And he or she will help you about what you must do. So I think it's an important thing starting a PhD during the residency. SEFH has also developed a manual of research and innovation for hospital pharmacy residents. It has been made by experts in different areas. And what is in this document? There are things about how to choose a method of investigation, the concept of big data, and development of a research project. But we are also worried about our tutors. So they're watching a tool which could help tutor to assess residents. And we have published tools for tutors when they can find models of assessment and advice about how to approach a well-balanced exam. Grants. I think that grant is the most important thing that we can offer nowadays to our residents. SEFH includes, among its proportion, the functions of promotion of the performance of all kinds of training programs. These actions are directed both to acquire a high level of knowledge, and you can go to an international center when you can improve your language, you can know how other services work, and you can also learn a lot of pharmacy aspects of our profession. There are two types of grants. One of these is International Centers of Excellence in Hospital Pharmacy. And another type of grant is grants for the extension of a study. We are going to see the two types. In 2015, SEFH created this type of grants, International Centers of Excellence in Hospital Pharmacy. We signed agreements with some hospitals, and our residents can go there and learning with a training program which is directed by a tutor. There are some examples of it. For example, Yale, New Haven in the USA. We have 3 international centers interested in cooperative and joining forces in this scope. And one of them is Antrim Area Hospital in Northern Ireland, in UK. Why? We're interested working with the National Health System because they have clinical pharmacists, and pharmacists are part of a multidisciplinary team. And that's what we're interested in, learning from them and learning also from doctors. What do they do, for example, in Antrim? They learn about warfarin, transmission antimicrobial stewardship, and also a pharmacist consultant specialized in rheumatology. They receive 4 residents per year since 2015. For example, this is Liam, who is like a father for our residents. Then Yale, New Haven, the USA, it's about 4 or 6 weeks. Our residents learn a lot of things about critical care, emergency medicine, ambulatory care, infectious disease, transplantation, oncology, hematology. But they only receive 2 residents per year. We have also recently signed a new agreement in Lincoln, in the UK. They do a lot of different activities like cardiology emergency, home care, and aseptic productions. And they accept between 6 or 8 residents per year. That's new for this year. But we also have another type of grants. For example, there are grants for the extension of a study. And this consists grant with hospitals that we haven't signed yet an agreement and are national and international. For example, here in Spain, we have Gregorio Marañón, which offers a period of time about genomics. They receive between 1 and 2 residents per year. And Brigham and Women's Hospital, one of the most famous hospitals of the USA. They learn about patient pharmacy, cardiology, oncology, hematology, but they only receive 1 resident per year. It's also new for this year as Lincoln from the UK. Meeting for R1. I think it's one of the most important activities. Why? Because you are a youngest resident, you receive lots of information in a short period of time. So we do this annual activity with a double objective. The first is explaining how our society works and what they can gain from it. And the another objective, which is also so important, is meeting their colleagues from other areas of Spain. Why? Because they are going to work with them in some projects. So this is a space which let them being in this context. SEFH also wants to stimulate and recognize the work of residents. So that's why we have an hour for the best hospital pharmacy resident. She's Mercedes, and she won this prize last year in the last Congress. We make a global assessment where we have into account different things like the CV, the number of clinical sessions presented, and scientific books of chapters published. Resident online. I think that there is a need of improve the presence of residents in the media. So that's why we have taken different actions. One of it is updating our resident web. We have created a resident committee to debate the best table of contents. Why? You know that many hands make light work. SEFH blog. We have created a specific section from residents where we hope to publish useful links for residents, like, for example, clinical pairs of pharmacology. And social networks. We encourage residents to discuss and to participate in scientific debates. We can't be a passive member in our society. In fact, every member of the residence committee that you have seen before has a Twitter profile, and we frequently publish interesting comments or ideas for the residents. Working with other societies, I think it's so important. Why? Particularly believe that we always must work together with doctors, always. He's Jorge Álvarez Troncoso. He's the representative of another resident society, and I contacted him by Twitter, and now we are working in some projects. For example, we are designing clinical cases where he prepares the part of the pathology, and we prepare the pharmacology aspect of the case. More presence in the National Congress. We are going to allocate for the first time, a space of residence in the next Congress, which will be in Palma de Mallorca. We have a resident space called "We Are at the Bottom of a Pile." Why? We are at 60% of our society, so we must participate, and we want to have a space for residents in the Congress. We'll discuss different things like tools used to investigate job opportunities at the residents. And which are our current projects? Platform for training programs. We are working in a platform which could make it easier research and book. Why? Because until some days, you just always have to be sending emails, and it was so difficult when you wanted to book a resident hospital. So we are working in a platform where you just select the month of the rotation of the training program, and then in which area you are interested in. We are also working with clinical cases and courses made with other societies, for example, with Jorge Álvarez Troncoso. I would like to create a national group of resident representative of scientific society and work together with them. And then, personally, I think that we have to expand the offer of training programs with more hospitals, not just only from Europe, but also from the USA. So my personal conclusions are, SEFH offers a wide-ranging variety of possibilities to improve the training of hospital pharmacy residency. We can continue to improve the activities which are available for residents. And remember this, if we work together with other societies, we'll go further and make progress with more quality. Thank you so much.
Well, after these three wonderful presentations, that I think that describe pretty well the different aspects of our training for the specialization of hospital pharmacy in Spain, it's time for questions. First, I would like to ask if anybody here needs that the speakers speak in English for the questions. Anybody needs English, or we can speak in Spanish? Only one. Only one. Well, then we... Perfecto. Perfecto. Thank you so much for your comprehension. Then, yo abro el turno de preguntas en español. Me parece más comfortable, más cómodo para la gente que está aquí, algunos estudiantes de farmacia. ¿Alguna pregunta, por favor, para...? ¿Sí?
Muchas gracias.
Si es posible,
Hola, ahí está.
Decir de dónde venís,
Okay.
introduciros. Sí.
Soy María Eugenia Olivera, vengo de Córdoba, Argentina.
Ajá.
Bueno, mis felicitaciones a las 3 presentaciones muy interesantes. Me gustaría conocer de dónde surgen los fondos para financiar las estancias en otros países, en otros hospitales. ¿Cómo consiguen esos fondos?
Bueno, son fondos que tenemos tanto en la sociedad como en la Fundación Española de Farmacia Hospitalaria. Provienen bien de patrocinios o bien de los beneficios que sacamos de los congresos de la SEFH. Habitualmente el Congreso Nacional de la SEFH tiene unos beneficios y destinamos buena parte de estos beneficios a la formación y a las estancias de nuestros socios.
¿De qué manera? Veo que tienen mucha oferta online, ¿sí? ¿Qué caudal de recursos humanos se requiere para sostener ese nivel de actividad?
Bien, desde el área de formación, la verdad es que todos los socios son muy activos. Siempre hay un espíritu muy positivo y muy proactivo a la hora de estos cursos. Hay un área de formación y luego para cada uno de los cursos se buscan especialistas en esas áreas y a la vez tanto a nivel de coordinadores como de autores y sobre toda la gestión del curso, ¿no? Entonces, en ese sentido, la verdad es que tenemos suerte de tener pues, gente que nos apoya mucho y que actúan y participan activamente.
Okay, gracias.
Buenos días o buenas tardes. Yo voy a hacer las preguntas en inglés porque no quiero asesinar vuestro idioma, ¿vale? I'm from Portugal, so probably some of the questions don't make sense for Spanish people because they are very aware of the reality in Spain. Your training for hospital pharmacists is very demanding. And I think we in Portugal need to learn from you, specifically the pharmacists, hospital pharmacists, in order to improve the type of training that we have in Portugal. I noticed that you also spoke about the technicians, and I was unaware, or I am unaware, if they have formal training here in Spain, and who regulates that, if it's SEFH, or if it's the Ministry of Health. And I also noticed that regarding the vacancies, that las plazas, they are very little number. So what type of criteria do you use to establish, for example, that in one hospital you have 20 vacancies for hospital pharmacy and only 1 for radio pharmacy, for example? And regarding the online training, I noticed that you have several courses. I don't know if they give formal assessment, and if it does, how do you have any method of guaranteeing the identity of the person doing those tests or those cases? Thank you.
No.
Hola, ahora. Bien, un poco desde el área de la formación, si voy muy deprisa hablando, perfecto. Desde el Departamento de Formación de la SEFH lo que tratamos siempre es un poco de cubrir las necesidades formativas de nuestros socios. Bien, para ello como la SEFH está estructurada en grupos de trabajo, en grupos de expertos, lo que hacemos un poco es planificar las diferentes áreas y necesidades formativas en función a lo que captamos que ellos necesitan para ir mejorando el día a día de su profesión, ¿no? En cuanto a la segunda pregunta que hacías, el área de formación, ¿cómo garantizas la identidad o la identificación del usuario? Tenemos hasta ahora, el proceso de formación en el momento actual está en un cambio importante, ¿vale? En cuanto a un sistema de gestión de los cursos, un sistema de procesos, y ahora estamos en un momento de innovación importante. Entonces, hasta ahora, como se ha hecho, era con usuario y contraseña. ¿De acuerdo? Sí que estamos pensando en posibilidades, tanto a la hora de evaluación, que sea más innovador, que sea más instructivo, que no se base solamente en el examen, sino también en casos prácticos, en una serie de actividades que vaya más allá del puro test, del test de evaluación. Y podríamos, por ejemplo, el tema de la identificación, conocemos que hay desarrollado programas que incluso con la webcam, ¿no? Con del laptop o del computador o el ordenador que se use, pues puede identificarla a la persona de tal manera que tiene una visualización constante de su imagen y no permite que haya lapsos o ausencias, ¿no? Entonces podría ser una solución. Y la segunda cuestión te respondía.
Bueno, en cuanto al número de plazas, el Ministerio de Sanidad pregunta a la Comisión Nacional cuál cree que debe ser el número de plazas. Con esto y teniendo en cuenta la necesidad de especialistas por las jubilaciones que pueda haber y las necesidades, establece un número máximo de plazas anuales. Luego, cada comunidad autónoma, cada región, tiene su cupo de plazas. El cupo que tiene cada región es total, quiere decir que son plazas de farmacéuticos, de médicos, de psicólogos. Entonces, en cada región luego se valora cuántas plazas van a ser para cada especialidad y con esto sale la oferta anual.
Para hablar nuevamente de las plazas, in Portugal, for example, for doctors, for medical doctors, to calculate the number of vacancies for 3 specialists, they can have 1 resident. I don't know if this applies here. Regarding the technicians, you didn't answer my question. I don't know if it is SEFH or Ministerio that does the training of those technicians.
A la primera pregunta, en España no se hace así. En la segunda pregunta, los técnicos de farmacia aquí en España tienen una titulación de formación profesional grado 1, que es similar para hospital, oficina de farmacia o cualquier puesto. Lo que sí que hace la SEFH es tiene un programa de formación específica para técnicos dentro de lo que es farmacia hospitalaria, que está dentro del programa que trabaja la Dirección de Formación.
Hola, bueno, yo soy de aquí de Salamanca y estoy en quinta, así que estoy conociendo un poco este mundillo. Y me ha llamado mucho la atención lo de las becas que has comentado. Quería saber qué requisitos ponéis para que esos residentes, porque has dicho que, pues eso, que puede ir 1 o 2, ¿qué requisitos tiene?
Evaluamos... ¿Va bien esto? Evaluamos una serie de requisitos, por ejemplo, el currículum, las publicaciones, también el nivel, por ejemplo, de inglés, si tienen algún tipo de certificado, el B2, cualquier cosa. También se han publicado artículos en alguna revista y el factor de impacto, y en función, bueno, pues un poco de todo eso, el currículum, las publicaciones, el nivel de inglés, pues ya hacemos como un baremo y le damos una puntuación a todas las solicitudes. Y ya los que obtengan más puntuación, esos son a los que se les concede la beca. Porque además en los últimos años sí que hemos notado, precisamente, no sé, un poco también por esa promoción el tema de las becas, animando a todos los residentes, redes sociales y todo, que cada vez hay más gente que quiere irse fuera. Antes había más como un poco de miedo, la gente pues decía, no, yo no me atrevo a eso, van a ser 3 semanas, no domino muy bien el inglés, pero al final es verdad que tenemos también buenos tutores allí, que les acogen, les enseñan, bueno, pues dónde están sobre todo las cosas, si necesitan algo, se preocupan mucho por ello, y son más, ya digo, como padres de residentes. Y yo creo que entre eso y la promoción que estamos haciendo, cada vez sí que es verdad que están teniendo una aceptación y cada año intentamos ampliar todo el tema de las becas.
¿Alguna pregunta más? Yo sí que me gustaría hacer una última pregunta a Ana Lozano, como vicepresidenta de la SEFH y sobre todo como miembro del Comité Nacional de la Especialidad, que nos ha comentado un aspecto que para todos los servicios de farmacia hospitalaria del país estamos esperando un poco, como decimos, como agua de mayo, y es el nuevo programa de formación de la especialidad. En concreto, pensamos que va a ser un programa tan ambicioso y tan amplio que mi pregunta es, ¿cree la Comisión Nacional de la Especialidad que los servicios de farmacia van a tener que reacreditarse para realmente comprobar que pueden cumplir el nuevo programa de la especialidad cuando éste se tenga que implementar?
Bueno, en principio la legislación sí que establece que si hay un nuevo programa tiene que haber reacreditaciones de las unidades docentes que tienen residentes. Lo que pasa que en las últimas conversaciones con el Ministerio, con la Dirección de Profesionales, se nos dijo que probablemente en un principio serían autoacreditaciones, que no vendrían a auditarnos para acreditarnos. Esto fue con el gobierno anterior. No hemos todavía hablado con este nuevo gobierno de cómo, con los cambios que ha habido de ministros y demás, cómo se va a hacer. En principio, lo que sí que nosotros pensamos es que vamos a tener que hacer un esfuerzo muy grande porque evaluar por competencias todos estos dominios y estas competencias que os contaba antes, y además tenerlo que hacer con los instrumentos que establece el programa, porque el programa establece que cada competencia se tiene que evaluar con unos determinados instrumentos, sí que va a ser complicado y sí que va a llevar mucho tiempo, sí que vamos a tener mucha más necesidad de recursos humanos para hacerlo y bueno, a ver cómo podemos adaptarnos a esto, que yo creo que sí que es un paso adelante en la formación y evaluación, pero que nos va a suponer un gran esfuerzo.
Muchas gracias, Ana. Una última pregunta, si hay en la sala, ¿no? Bueno, pues yo creo que es una hora, un tiempo perfecto para dar por terminada esta sesión. Todos los que estamos aquí esperamos que haya sido útil para todos. Desde mi punto de vista, creo que se han cubierto todos los principales aspectos de la formación que se lleva desde nuestra Sociedad Española de Farmacia Hospitalaria, que, como comentaba cuando estaba sentada con los ponentes, realmente todos los miembros de esta sociedad y sobre todo la Junta Directiva, aprovecho ya que está aquí Ana, y todos los miembros de formación de la SEFH hacen un trabajo excepcional que no cabe duda de que contribuye a una mejor formación de todos los que somos miembros de esta sociedad y nos sentimos realmente orgullosos de ella. Así que, bueno, gracias a todos por vuestra presencia de nuevo y que tengáis todos un buen día. Gracias.